My name is Professor Susan Serid, and I am chair of the Sociology and Criminal Justice Department at Suffolk University and a member of the Women in Incarceration Project at the Center for Women's Health and Human Rights.
Hi, I'm Deb Goldfarb, a social worker and advocate. I work in behavioral health leadership at a Boston area hospital and teach part-time at Boston University School of Social Work. Today, though, I'll talk about my experiences working within the Massachusetts Department of Corrections at Framingham Prison.
Hi, my name is Cassandra Ben-Sahi. I am the coordinator for Massachusetts Against Solitary Confinement, and we're under the umbrella of UU Mass Action. So I'm glad to be here today. I'm also a formerly incarcerated mom. I was incarcerated at MCI Framingham.
We'd like to present the Women in Incarceration Project's research on why Massachusetts does not need a new women's prison. Let's first look at the state's plan to build a new women's prison. The Massachusetts Correctional Institution at Framingham, known as MCI Framingham, is the only state prison for women in Massachusetts. It was built in 1877 and it's in terrible shape. Women receiving sentences of more than 2.5 years go there, while some women with shorter sentences are sent to the local county jails. The Department of Corrections, or DOC as it's called, plans to close MCI Framingham by 2024 and spend at least $50 million to build a new prison. So we're going to take a quick look at who makes the decision to do this. The DOC, the Department of Correction, which oversees all state prisons, is under the authority of the governor and the executive branch. In Massachusetts, the governor can use bond money without permission from the legislature. In other words, the legislature does not have a say in how this money is used. If the governor does not change this plan, the best chance of stopping the plan for building this new prison is for the legislature to pass the moratorium bill, an act establishing a jail and prison construction moratorium, Senate Bill 2030 and House Bill 1905 in this legislative session. This law would put a pause on any new prison and jail construction for 5 years while other plans are studied. The moratorium bill is being spearheaded by Families for Justice as Healing, a Roxbury-based organization led by currently and formerly incarcerated women and girls. Our concern is that a new women's prison is an expensive solution for a small number of women. The population of women at MCA Framingham as of January 1st, 2021 is 166 women, according to DOC data. We know that prison causes or exacerbates women's trauma and poor health at the same time as it pulls women out of their family settings and causes extensive disruptions in their lives. We also know that very few women commit acts that really cause a risk to public safety. We believe there are better solutions. But again, I want to reiterate that we're talking about spending $50 million for under 200 women, and that's only the start. On top of that, at this time, each woman who is incarcerated costs the state over $162,000 per year. For 150 women, that means operating the prison will cost about $24 million every year, year after year, in addition to the $50 million initial cost. Here we have figures from the DOC. In 2014, the number of women in the custody population of the state was 800. In January 2021, it had fallen 75% to under 200. The numbers of women incarcerated in Massachusetts have been declining steadily and are expected to continue declining. So we're talking about spending an enormous amount of money for small numbers of women, numbers that have been consistently getting smaller and smaller for over a decade. We also want to stress that while the majority of women incarcerated in our state are white, Black women are imprisoned at MCI Framingham at twice the rate of their share of the Massachusetts population. They are 8% of our state's population, but make up 18% of the prison's population. I'm going to talk now a little bit of the life experiences of women who are incarcerated, and you're going to hear more about that later on from the other speakers. Incarcerated women are likely to have been victims of gender-based abuse as children and as adults. They tend to experience chronic health conditions at rates much higher than other American women. And many incarcerated and formerly incarcerated women experience housing insecurity and homelessness. The DOC has stated that they would like to design a trauma-informed prison. That statement acknowledges that incarcerated women need services to deal with trauma suffered, gender-based violence and other kinds of trauma, and that they need services to deal with health challenges, substance use, and mental health challenges. In fact, studies show that over 80% of incarcerated women suffer from these problems, many beginning in childhood. However, we know from the research literature that prison causes women's trauma and exacerbates women's poor health. There is no such thing as a trauma-informed prison. The very act of being in prison exacerbates and causes trauma. The idea of a trauma-informed prison is not a scientifically based concept. We'll hear now from Deb Goldfarb, a licensed social worker who worked at MCI Framingham for 4 years until 2020.
Hello, I'm Deb Goldfarb. During my time at MCI Framingham, I provided mental health services to hundreds of women, both as an individual clinician and one who provided group counseling and crisis intervention. Every day I worked at MCI Framingham, I saw how incarceration was harmful to women's health. The policies and practices that impact the women's well-being are more significant than any type of building that could be designed. For all women, transitioning in and out of prison causes disruption in doctor-patient relationships, medication, and insurance coverage that could be avoided if women remained in their communities. The Women in Incarceration Project reviewed 200 studies that looked at prison-based mental health treatment. There was no evidence that prison-based mental health treatment is effective. And from my professional experience at MCI Framingham, I can say it is impossible to provide ethical care behind prison walls. Incarcerated women harm themselves at substantially higher rates than women outside of prison. There is little evidence that treatment in prison is effective. DOC was criticized by the U.S. Attorney for inadequate mental health care and violations of constitutional rights, resulting in self-harm and suicide. This was highlighted in the 2020 DOJ report on the punitive and harmful practices of mental health watches in facilities. Prison conditions are particularly dangerous for older women with cognitive and physical impairments, putting them at risk of injury and decline. And prison only harms health. Prisons are full of trauma triggers, lack for failure to follow rules or obey orders, absence of control over whom one does or does not socialize with, limited freedom of movement, limited control over time and personal space, and traumatizing pat-downs and strip searches. Researchers have shown that prison in any form, even the nicest prisons, are antithetical to building a sense of autonomy and empowerment. There are better solutions. To give you an idea of further solutions for decarcerating the women currently at MCI Framingham, I want to introduce Cassandra Ben-Sahi.
MCI Framingham's female custody by commitment type on January 1st, 2021 was 18% pre-trial detainees, 30 women. You can see here civilly committed, 1%, one woman. Sentenced, 81%, 135 women. That's not a lot of women. And it's pretrial detainees. This is why we know we can do something different. When I went to prison, it was a shock. You know, you hear about it, and next thing you know, you're there. I was sent to prison for a technical violation of my probation. I had a substance disorder, but I wasn't offered any help with that. And you can see these facts here. 1 in 3 women. I was like in my 40s when I went to prison, 49. Women in prison at Framingham are age 50 plus, 1 in 3. Middle-aged and older women have very low rates of recidivism. Yet we don't commute sentences, and we haven't done anything to help that. All women, including from this age group, are eligible for compassionate release, but we won't let them go. We've got to do better. That's got to be the mission. Not building new prisons looking for the same old stuff. Let's talk about some of the data, all right? DOC 2020, female admissions by type. New court commitments were up 66%. Why weren't they using other ways? Parole violation detainees. Parole violations. I was in that group. Transfers. Probation violations. Readmitted from court release. Nobody escaped. Right. Again, we don't need to build another prison. These are ideas. All that's required of a prison or correctional facility is a building under the DOC. Infrastructure requirements do not mandate locked doors or any particular form of enclosure. Women could be transferred to community-based facilities without any change in statute. We have multiple opportunities for diversion from incarceration, better use of social work and crisis response professionals, referrals to community services, reducing or eliminating cash bail in pretrial detention. Reducing or eliminating cash bail, I'm for eliminating it, in pretrial detention. Community alternatives at sentencing, alternatives, that's the word. Delayed sentencing for service provision, reducing probation and parole revocations. When you get arrested, there's always a cell somewhere for you to be put in. But when people are in trouble, mentally ill, or they have substance disorders, there's always a wait. You gotta wait for those beds. That should be an automatic thing, help. Let's summarize this. A new women's prison is an expensive solution for a small number of women. So opening a new prison for $50 million with $24 million yearly operating budget at the current cost of $162,000 per woman per year for under 200 women puts no money into our communities. Develop a national model for decarceration and alternatives to prison. We've offered some. There's been places that have been changing things, and Massachusetts has been talking to those people. Let's concentrate on that, because what you concentrate on grows. You don't want to build another prison and then try to fill it.